2 seconds. Okay. Good evening, everyone. Good evening, viewers. Namaste from Nepalese and from all of us here. And this is Sumantim Sinha. I'm just the organizer, and I'm here to introduce our tonight's host. But before that, I just want to give you a little background. This election is very critical for us, for all of us, for all Americans, everyone who cares about each other. And there are lots of issues. It's more than just political parties. So we want people to know what these issues are. So we have been doing this issue-based, basically issue-based conversation for last couple of weeks. So today we are focusing on healthcare, and we have tried to bring as many people as we can bring for one forum for 1 hour. And before that, I just want to introduce our today's host, Dr. Vijay Acharya. He is a practicing physician at Johns Hopkins University. He's also a faculty with the Hopkins University's Armstrong Institute of Patient Safety and Quality. He has a background in patient safety, quality improvement, clinical informatics, and a lot more. So I just want to keep it brief at that. So Dr. Acharya, it's all yours. Thank you very much.
Thank you for the opportunity to talk to amazing individuals. So the program outline will be, I will quickly introduce our panel, and each panel will give in talking points for like 5 to 10 minutes. And then after 15 minutes or so, we will then open up for like Q&A. And then Mr. Timson, I will also like screen questions that we get from Facebook and our webinar. And then we'll talk mostly around like election, healthcare, and COVID, which is a burning topic, how based on our like wide experiences, we can work together to like sort of end the crisis, as well as COVID solutions. As you can see prominently, voting is, elections like very near. And we need to vote early. You can also scan the QR code by using your phone that you can see on Dr. Sharma's background. That should open up a Vote 2020 web page, if I'm not mistaken. There you can check if you're registered, or if you can, if you're already, in your registered to vote, so which is very important. All right, so quickly I'm gonna go around and introduce our panelists. So first off, Dr. Manisha Sharma. She is a board certified family medicine physician who works in the juncture of patient care, community health, social justice, health policy, and innovation. She currently serves as the medical director of a community health group, a nonprofit health plan, serving 300,000 plus Medicaid and Medicare members in San Diego area. Dr. Sharma lives in San Diego, where she works in grassroots organizations around like justice, equity, and clinical work. Next is Dr. Francis Jaraz, who is a recently retired pediatrician after 50 years of practice in the Philadelphia area. He initially trained in University of Bombay, and then later in Buffalo and Georgetown. He has been very active in his local community, working with politicians as well as other activists to provide support to immigrant communities and refugee population in Philadelphia and advocating for them. He has definitely seen a huge like sea change across like healthcare system across many years. And he serves as an advisor to many government and non-governmental agencies. And we just found out that he was a pediatrician to Ro Khanna and Raj Shah, who are like prominent like politicians. And then lastly, we have Delegate Suhas Subramanyam, who is a first-time member of the Virginia House of Delegates. He grew up in Houston, has a law degree from Northwestern, and was a formal technology policy advisor for the Obama administration. Also like clerk for U.S. State Judiciary Committee. He has previously served on the Loudoun Health Council in Virginia, and serves on like several important committees, subcommittees, has orchestrated several important bills in the state. So with that, I would like Dr. Manisha Sharma to like start the session with a few of her thoughts.
So first of all, thank you so much for having me. And I'm really honored to be here in place of Dr. Kavita Patel, who was originally supposed to be here. So I think my thoughts are based off of where we are. Healthcare is everyone's business. And, you know, whether you're in the healthcare business as a physician or a healthcare worker, or you're the next door neighbor taking care of your family members, taking care of your next door neighbors, healthcare is everyone's business. Health in itself, if you are not well, you can't work. If your children are sick, they can't go to school. And so these are things that actually should matter to everyone. Right now, where we are in this year in particular, is that our healthcare system has very much shown itself to being broken. It was designed broken prior to the pandemic, and the pandemic has exacerbated and showed that it's more broken than we ever actually thought and imagined. The ACA, the Affordable Care Act that was passed by the Obama administration, was our first step to trying to mend and heal the system. And we have now an administration that is actually trying to take it away. COVID has actually been able to highlight where the gaps of our care system is. And it is really important to understand that the repealing of the Affordable Care Act actually leaves our country in serious, dismal jeopardy. I think Senator Harris said it well in the debate the other night, where she's saying that the administration is coming for you. We have 30 more million people in the United States who are unemployed. Prior to COVID and prior when the ACA was actually passed, 51% of the people who are working in this country actually receive their health care from their jobs. So there are a whole set of people who don't have ability to getting health care if they're too rich for Medicaid and too poor to actually get health insurance on their own. The Affordable Care Act filled that gap. And now we have someone who's kind of stripped that gap. In addition to that factor that we don't have states that are still expanded on Medicaid, which is our social safety net. I think it's also really important to understand that the things that the Trump administration is saying in regards to saying that they would protect pre-existing conditions, I think it's really important to understand that that protection is actually weakening what the Affordable Care Act actually has in place. So even though he may keep it, it's actually going to weaken the structure. And in order to weaken, when you weaken a structure, it's actually easy to pull out from under people. So I think that if you are looking at this election, if this is the first time you're considering to vote, if healthcare matters to you, it matters to your family, it matters to your next door neighbor, it matters to you taking care of your family, I think it's really important to understand to vote health and be looking at this as a chance for you to show your voice, to feel empowered over having a say on how things can be done. I do believe that the Trump administration will repeal it. He's also has lots of sort of tactics in place. He doesn't have a plan that actually would actually bolster or make expand people to having coverage. And I think it's really important to understand the differences between what Vice President Biden and Senator Harris is proposing as a plan and what President Trump is proposing as a plan. And I'm happy to explain that today.
Thank you for that. Next, we have Delegate Suhas Subramanyam, who will give us some thoughts around the upcoming election and its impact on healthcare.
Great. Thank you so much, all of you, for being here. Thank you, Simone, for inviting me. Looks like I'm the only non-doctor on the panel, so don't consider me the expert on action.
Suhas, you are on mute.
Oh, apologies. Well, can you hear me now?
Yep.
Great. Yep. Still getting used to this whole virtual Zoom thing. So It's 6 months later. But my name is Delegate Suhas Subramanyam. Thank you all for having me here. It looks like I'm the only non-doctor on the panel, so that's talking about healthcare. But I'm very happy to have all of these experts with me today, and thank you, Simon, for inviting me. I represent Northern Virginia in the General Assembly of Virginia, and but one of my first jobs out of college was as a low-level staffer on Capitol Hill. I was given basically 2 issues to handle for a member of Congress from Florida, and one of them happened to be healthcare because I was a junior staffer and they didn't think it would be a big issue. But it turned out I ended up having to negotiate a bill called the Affordable Care Act and write several provisions of it, or at least draft provisions of it. And one of the things I learned about the Affordable Care Act was it was never meant to be a final draft. It was compromise legislation. We thought at the time that we would come back and fix all of the quirks of it. And instead, what's happened over the past 10 years is that we have actually made it much worse. We have taken the good parts of it and gutted it, and we being our country, and we have taken the bad parts of it and let them shine, for lack of a better word. And so that's what you have today is our healthcare system was the product of a compromise that not everyone was happy with, but we thought was so much better than what was happening before, which was people going bankrupt and basically taking lesser jobs because of the health benefits. And we're just slowly starting to get back to what it was before, which was not a good system for anyone. And this pandemic has, as people said earlier, highlighted that. And one of the things that made me want to run for political office as a candidate myself, instead of working for other elected officials, was the fact that in Richmond, the capital of Virginia, the General Assembly actually received federal money for Medicare expansion to provide free health benefits to people who couldn't afford it. But because the Affordable Care Act and our healthcare system was so politicized for almost a decade, Virginia just sat on that money and did nothing with it. And it wasn't until we had a Democratic majority and folks like myself get elected who would never otherwise run for office that we ended up passing Medicare expansion in Virginia and using the money instead of letting it sit and rot in the US Treasury. And so because of that, hundreds of thousands of Virginians have health care. We would be so much worse off in this pandemic had we not had that. But that just shows you the stakes in these elections and why it's so important to vote and why you shouldn't be intimidated by any sort of scare tactics or negativity, is because these elections are literally life and death. And I'm a strong Democrat. I'm a pretty progressive Democrat. But I'll tell you that it's not even about Democrat, Republican. I know a lot of Republicans who felt like they needed to pass Medicaid expansion. They ended up getting the votes to do that, who feel strongly, but they feel like the voters right now are only responding to the polarization. And that's where you, the voters, come in. We really need you to make your voice heard on healthcare. We really need you to tell not just Democrats, but also Republicans that the only acceptable thing is affordable healthcare for all, and that anything less means you're not going to be voted into office. That's the message that I hope people can send this November, because we can talk about policy proposals all we want, but even 10 years ago, when we tried a public option, when we tried affordable healthcare provisions, people told me that we didn't have the votes for it in the general public, that senators would be too vulnerable because they voted for something like a public option or something like expanded Medicaid. So I'm very much looking forward to the perspectives of others on the panel and answering questions, but please, please vote this November because your life really does depend on it.
Thank you for that. And then we will move on to Dr. Francis Jaraz, who is a pediatrician, as I had explained earlier, and looking for his thoughts and wisdom regarding upcoming elections, and if he could also focus around like how it's going to impact our like children's health, especially with the COVID pandemic. That'd be great.
Just Suman, thank you so much for inviting me in the midst of tremendous panelists. And I think Manisha and you have already said many of the things that I wanted to say, but maybe I'll repeat some of the same things. First question that I have to ask myself is, what is the responsibility of the government to its citizens? And I think we have failed in a way. If you go by World Health Organization statistics, US is something like number 35 in the world. Can you believe it? See, very often, when you go around, people will tell you we have the best healthcare system in the world. But you'll be very surprised if you compare to many countries, including so-called third world countries. We are actually far behind in accessibility, cost, and many other, many metrics that you can go by. So it is not at all surprising that, in US, till President Obama and Vice President Biden took over, as many as 47, 50 million people were uninsured. And that is for a country that is supposed to be the richest country on earth. That is almost like, to me, it's almost like unbelievable. And like one of the speakers, said earlier, when President Obama and Biden, took over, their goal was to redo, especially the healthcare system, which in many criteria you could say, is somewhat broken. And with a lot of resistance from the opposing party and the stakeholders like insurance companies, like hospitals, they had a very difficult time, including, many Democrats, I must add. They did not want to change because of the power that insurance companies and hospital systems and powerful pharmaceutical companies had on this thing. So actually the Affordable Care Act or the Patient Protection Affordable Care Act, ACA or Obamacare, when it was finally passed, actually it was a very dilute version of what the Obama administration actually wanted. And like one of the speakers again said, the hope was that was just the beginning, and other changes needed to be made as time went on. And I just wanted to touch, some of the very important things, important provisions of the Affordable Care Act, which was one of the things was to provide affordable insurance at a reasonable cost to those who needed it. And again, expanding Medicaid, again, the Medicaid population is very, very large. And again, most states, I think like about 14 or 15 states would not participate in expanding Medicaid insurance in their areas. And of course, the individual mandate, again, under President Obama, the hope was that, if you had an individual mandate, everybody would have to buy insurance, and that would lower the cost. And likewise, taking care of ladies, contraception was a very, very important thing. And I'm not quite sure how many people are familiar. Mental health is a serious problem in US like any other country. Generally speaking, mental health does not get good insurance coverage. And under Obamacare, it would be treated like any other illness. Same thing like pre-existing conditions. As many as 100 million Americans, have pre-existing conditions, from diabetes to heart disease. Now, COVID-19 might be considered a pre-existing condition. And the problem is, depending on who you vote, all this could change. And I think, like Manisha said, I think Vice Presidential candidate Kamala Harris pointed out directly at the electorate. It's in your hands. Do you want all those privileges, or do you want to cut off? Bankruptcies, I think one of the biggest causes of bankruptcies in US actually is healthcare cost. You'll be surprised people have to really sell their homes, mortgage their homes, all kinds of things just to pay for medical care. Can you imagine that? Now, children, since I'm a pediatrician, in the area where we live, in southeastern Pennsylvania, it's an area with a lot of pharmaceutical companies, computer companies, businesses. I would say the insurance rate is very high in this area, but nevertheless, I'm actually a volunteer in a free medical clinic. And I can tell you, even in this prosperous area, see, what people do not realize, things like homelessness, things like no insurance, are kept very required. For example, when you say homeless in the area that we live in, you expect somebody, with a backpack sleeping under a bridge. That's not the case actually here. A lot of people are homeless, yet, they're subsidized and somebody is paying for their home. Same thing with the healthcare. A lot of people do not have healthcare. And the free clinic that I go to, we probably see something like, like 20 to 25 children every single day. With that, I'm going to, pass it on back to you.
Thank you, Dr. Jeyaraj. So first, I will start the Q&A session. Thank you to our panelists, and apologies for some of the spam that was directed earlier. We blocked all the questions, so it has to come through Mr. Timsina. Again, it's kind of depressing that people have time to send spam messages on such an important issue, and especially again. So moving on to the Q&A sessions, we have a wide variety of expertise between the three of you, and also if I may say that, from clinical practice to policymaking to legislative action, we have a whole gamut of experiences, as well as plan expertise from Dr. Sharma, who runs a Medicare plan, and we can understand the benefit of it, because we see it in daily practice. And me myself, as a practicing physician, I see the impact of all these decisions that are made from small city level, like county level, to state level and federal level. And every time people say I don't like the two candidates, I think it is beyond those two candidates. It's the whole level, like your education board, your county officers, your judges, your state delegates, your congressmen, congresswomen. You're voting for the whole other what you call as typical down ballot candidates, and they're the ones who are deciding bulk of your issues, that day-to-day issues. And federal level, because of the structure the U.S. Government is set up as, federal structures have very limited impact on your life. And so you need to vote. You also need to be aware of how to get information around your down ballot candidates, as well as what they stand for. And I think, with that sort of statement, I want to ask Delegate Subramanyam about I recently voted. I just voted for the upcoming election, and I had a really hard time finding out what every judge stands for, what the election board, the education board member, the county board person stands for, because there's not a lot of information regarding down ballot candidates. We focus so much around top to presidential tickets, so as to speak, but we really don't have a way to understand what our local politicians have in mind, or what they stand for, where we can find it, how do we engage with them. And one of the things I've realized, at least in the US, is that is way more crucial to bring your issues forth. And I've worked with some of the immigration-related issues for refugees back in Boston, and we had a refugee-related office in the senator's office, which we didn't know. Do you have any thoughts around how local government officials as well as local politicians can be more active in reaching out to their communities? This question.
Absolutely. Thank you for the question. I mean, in Virginia, we have elections every year, and the state level elections are on the odd years. So there's no state elections this year, it's next year. And then the federal elections are even years. So there's obviously federal elections this year. And, I think you make a good point that the people that, I worked at the federal level. I was actually an advisor in the White House. And I can tell you, even when I was at the White House, I was calling a lot of governor's offices, asking them to implement things that the president had decreed through executive order. Because in the end, the states have a lot of the sway in our current system. And even when the federal government passes legislation, it often leaves implementation to the states. And then, obviously, like you mentioned, county supervisors, mayors, those are all very important positions that affect your everyday life. I think if you have about 5 to 10 minutes one day, you can just Google some of the candidates on your ballot. It's very easy. I've seen people at the ballot box just take out their phone when the ballot's right there and just Google some of the names, you'll be surprised at what you can find through a couple searches, Bing, whatever search service you use on the positions. You'll see pretty clearly that there's often very steep contrasts between candidates in every race. And sometimes these races are not partisan. So there might be two Democrats running against each other. Maybe it doesn't show the partisanship, but maybe the party endorses one or the other. But the point is, getting educated doesn't take a lot, and it's totally worth it, because you should know how people feel, people stand on healthcare, not just at the presidential level, but at the county supervisor level. Our county supervisors are allocating money right now that we gave to the counties to implement COVID testing, for instance. So there's some counties that have county supervisors who think COVID is a hoax in Virginia. It's true. Or think COVID is outlandish to even think about, and we should not be spending that money. And so they just sit on the money and do nothing with it. So those are choices that are made up and down the ballot. So everyone you vote for is consequential. So I think just a quick search will yield a lot of results for you, and you'll see pretty clearly the right candidate, especially on an issue like healthcare.
Thank you for that tip, and I really appreciate this. At least the mask mandate issues, and we've seen those videos of people like fighting. Again, it depends really strongly about like who you vote into office, because these are the people like deciding what to do with their lives. Next, I want to ask Dr. Sharma about her experience about working in community health centers in a really underserved area to working in the administration in a huge like policy level, and how you see what sort of appropriate response would have been if everyone was like told in February or like early March like how the scale of this COVID pandemic would be. Can you shed some light on like any experiences that you have had, especially within your company, around like how you've been trying to address this sort of disinformation, sludge of disinformation, and try to like inform your members about like what an appropriate response is?
Yeah, first, I just want to echo what Delegate Suhas said. I think he's absolutely on point. One of the things is that, like I'm in California, and one of the things I hear a lot of people say is, well, the state turns blue anyway, so my vote doesn't matter. But actually, it is about the down ballot. So I'm in a place like San Diego where it's predominantly pretty conservative. I'm actually very much like Delegate Suhas, where I'm actually left of the left. I believe in Medicare for all. I'm like, that's my personal stance. The ACA very clearly was an insurance regulation policy that was passed, which was very important at the time. I just want to state that I'm a physician that has a pre-existing condition, and I was not called a pre-existing condition until 2014. So why that's really important is because my pre-existing condition was I got hit by a car. And so it wasn't because of my own doing. I was a very healthy young person until I got hit by a car. And after that, I became a pre-existing condition. Now, to answer your question, so I work at the border. I'm actually what we call a street doc. I take care of folks who have complex issues. I do clinical care, but I also do clinical design work. And I am at a place that is a nonprofit that literally is a steward of tax dollars to go towards people who are receiving Medicaid and or Medicaid and Medicare as their health plan. So why this is important is because during COVID, because I'm a steward of the state, right? In a lot of ways, I am able to say, look, this is really important, and public health becomes a very crucial component. COVID testing, tracking and tracing, very important. So the messaging is out to getting people to say, hey, get tested. We get to work with the public health and the state to actually, in the governor's office, in order to understand the strategies that we can implement on the ground. So 5 foot close. What is it like to actually test people, all the way to building the system, and then all the way to try to influence some of the policy that may be coming through. To Delegate Suhas's point, which is so crucial, is that yes, this is not just about the federal elections, and it's not about Joe Biden or Trump. I think what it's about is what's the principle and ideology that you want your community to be following, right? So if you are, you know, like for instance, President Trump doesn't necessarily like Governor Newsom. And so there's a lot of tension over how those dollars are going to be implemented to the state of California and what Governor Newsom can do based off of his principles and his ideology of what to do on the state and local levels. So I think on the ground, I can tell you, we are a state, California is a state where people who are not documented are actually receiving Medicaid dollars to help cover them up until a certain age of 26. And so that's really one, as a state, we are protecting people. And it's really crucial because San Diego in particular is stuck between the border of Mexico as well as being in California. So what happens on Mexico 5 miles away from my home, right, is really going to impact the people that I take care of in this city. So I think it's what is really key here is really understanding who it is that's sort of controlling the dollars, if you will, of your community, your tax dollars that you're paying, and how you want those dollars to be delineated, and being able to have people to be the voice to influence. I can assure you that on a Medicaid standpoint or Medi-Cal here in California, we are very pro public health. And really putting out a lot of information to break the myths, if you will, about COVID, and being able to get people to feel encouraged. We do cover all testing whatsoever, I mean, all testing.
Thank you. Thank you for the information and your passionate advocacy. So Dr. Jaraz, you have practiced here for many years, and you've probably seen like a whole slew of like regulations and changes in the healthcare system from when you probably were like a resident till you retired. Have you noticed like what do you think this whole idea about like Medicare for all versus Medicare for people who want it? That was like what was like touted as potential sort of transitional plan towards like universal coverage. Can you shed some light around that?
I certainly, believe that healthcare and education are fundamental rights. And I think that's what makes a country, I believe. If you take again, US and compare it to, we cannot compare it to, let's say, small countries or developing countries. But let's say you compare US with Western Europe, particularly, let's say. You compare with the UK, you compare with Germany, France, Italy, Northern European countries, and some, Asian countries, let's say Japan, Korea, Taiwan, Singapore. These countries all have something in common. Their priority is healthcare and education. And the results show, that the quality of life that the citizens of those countries enjoy, their life expectancy, their hospitalization, no matter what metrics you use, they come out ahead of US. So there's no question in my mind that we spend, the most amount of money in healthcare. I believe we spend, per person about $10,400 or something like that per year. You are in informatics, you probably know this more than me. So, but yet, our results are the worst compared to any of those countries that I listed. And the result is, the reason for that is very simple. We are unfortunately, ruled by a very strong capitalistic system. The pharmaceutical companies, the insurance companies, they decide what goes on. And I'll give you a small example. I take some eye drops, and of course, the insurance for me covers it here. But I know it costs about $120 or something like that for a 5 ml bottle. And I was in Bombay, and my brother was taking I was in Bangalore, excuse me. My brother was taking the same drop. So, and I just checked the bottle and asked him how much it is. It is about $1, even less than $1. and it's made by the same exact company. You know, they all are generics. Most of them are made in India. They make it for the US market too. So what it is, you know, we have like an uncontrolled system. And that's why like under the Biden's, you know, plan on his healthcare plan, those are some of the things that he has proposed. Somewhat of a modified system to what Bernie Sanders has said. Biden's plan is somewhat of a middle of the course road. He wants to preserve, you know, private health insurance, which is fine, but he also wants to have some sort of, you know, healthcare that will cover, you know, most people. And I think his aim is at least 95 to 97% of the people. Generally speaking, you know, most of these companies are a little bit more liberal with children. I guess they have like a soft corner for children. But even then, I think the smart thing, I think, you know, like going forward, if we are to catch up with the rest of the world, you got to have some kind of a universal healthcare system. If you remember, actually, Mrs. Clinton, President Clinton actually had appointed Mrs. Clinton to actually create some kind of a system, if you remember, many, many years back. But obviously, the country was not at all ready for that, not even the Democrats. And even under Obamacare, as you saw, Obamacare actually faced stiff opposition, even from the Democrats. But I think that time is right now, especially people are seeing the impact of COVID-19 on a lot of people. A lot of people are without insurance. They do realize that there has to be a better safety net than what we have at the moment. Yeah, so I do believe that, you know, some kind of a central system, an affordable system, paid for by tax dollars. I believe that if you take all the countries that are listed before, they all have like a hybrid system. Even small countries like, you know, like Malaysia, Singapore, I'm very familiar with that. That's where I'm originally from. They all have a, you know, you'll be surprised, even as long as I can remember in those countries, they all had the system where the government provided in the medical care for all people, regardless of their affordability. Everybody was entitled for it. Even if you're a tourist, you could go to any Malaysian hospital or Singapore hospital, you'll be covered, just like in Germany or UK. So why that we are not able to do that? And you can be certain that, you know, the pushback, as much as President would the potential president, presidential candidate Biden has promised to enact it into law, you are going to have tremendous opposition. So how that'll come out, you know, I'm not quite sure. So for me, like I think, you know, Manisha said, the medical community has to play a very, very important role. And I'm just so sad to say that the medical community is somewhat weak, you know, in those areas. And when I've, over the 50 years that I've seen, they have not played an active role like maybe the primary care doctors do. For example, pediatricians, family practice, internal medicine, they seem to play a more active role compared to specialists.
Yeah, thank you for that. We have a question on our Facebook page. So this question is more towards like, because Delegate Suhas had worked on the ACA sort of design. I would like to have him answer this question. There's a question, could you please differentiate Affordable Care Act and what the Trump administration is proposing as their sort of healthcare plan, which sort of is very abstract, but again, you know, what is at stake? We do know like the pre-existing conditions are sort of at stake, but how does it like sort of get rid of or gut, as you said earlier, the ACA? If you could like just give a few pointers.
Yeah, that is actually a very good question. And as someone who really likes to study healthcare policy, I still couldn't tell you a straight answer, nor could President Trump himself, what President Trump's healthcare plan is. I know that in general, if you press President Trump or one of his supporters on what their healthcare plan is, after they've said all the how terrible the Affordable Care Act is, they'll start talking about things like trying to have insurance plans that go across state lines, trying to get at the issue that isn't really an issue of medical malpractice, trying to get, I mean, I think they're just talking points, and I don't really, the times where I've seen a plan was embarrassing. I wouldn't cover anyone, and it would still raise premiums quite a bit. And so there's generally not plans that are introduced on paper where you could score out a budget. So, I mean, I'll try to be more diplomatic, I guess, to end, which is perhaps, you know, there was a time where there was a completely private system where, you know, you could provide care to everyone. You could provide at an affordable rate. You could cover pre-existing conditions in a meaningful way, and give everyone what they want, basically. But that time is not right now. I've seen, and as someone who, again, you know, I practice law in this area too, you know, and I run up on private insurers all the time. The goal is to make money. That's what a company is there for. It's to make money. And they don't make money off of sick people who can't pay the bills. They make money off of sick people, but not sick people who can't pay the bills. And so if you want a system like that, where the sick people who can pay the bills have really good care, it's kind of what we have right now. It's still expensive for them, but you know, the system works for them. But then there's everyone else who can't really afford their bills. The system does not work for them. And in the end, we end up having to foot the bill anyway, because it's untenable in the long term. So we end up paying for emergency care rather than preventative care, rather than you know, the care that people really need. So hopefully that answers your question, because that's the best I can do. If someone else wants to take that,
yeah,
I think.
I will add to that. So as someone who also helped push for a passage of the ACA on the grounds, we worked very in line with the Obama administration through Doctors for America. So a couple of things, the difference here. So the Affordable Care Act basically said, look, if you're sick, we're not going to let people pick and choose or cherry pick what type of sickness. So some of the things that before the Affordable Care Act came about were, if you're pregnant, that's a pre-existing condition. You have an allergy to peanuts, that is a pre-existing condition. You get hit by a car, that is a pre-existing condition. If you have diabetes, hypertension, whatever it may be, all of those things could be deemed a pre-existing condition. And there was no control over one insurance company or the other to decide what pre-existing condition they would cover or not. The Affordable Care Act then regulated the insurance companies to say no pre-existing conditions. The Trump administration's and I'm not sure if I can ever be really diplomatic here, so I give Delegate Suhas lots of credit, but I'm not going to be, because there is no diplomacy here. What the Trump administration is saying is, we'll protect pre-existing conditions. What people are not seeing underneath the hood of that is that they actually want to weaken a pre-existing condition. So if you're in the state of Alabama, you could potentially have pregnancy as a pre-existing condition, versus if you're in Arizona, it's not. It allows for people to pick and choose what those choices of a pre-existing condition can be. And that is very scary. It's almost like a lottery. It would be like, we don't know. The other piece is, there is actually no plan. To Delegate Suhas's point, nowhere in any healthcare policy, Kaiser Family Foundation, health policy, health affairs, there's nothing that actually can give you a sort of a very solid plan. In the last 3.5 to 4 years of Trump's administration, he hasn't actually come up with anything. He just says he'll do it. So it feels very, there's no strategy behind it. I think one thing I just want to very clearly say is that even if you're not for Vice President Biden or you're not for President Trump, it doesn't matter. It's about the moment. It's not necessarily about the man, it's about the moment. And if your moment right now is, I am worried for my family, I am worried for my neighbor. I am worried about not having insurance if I don't have a job. I'm worried about not being covered. I think that's really why this election is really crucial in 2020. It's about the moment. What do you want the next 4 years to look like? A chance at being able to have access to things that would protect you and yours? Or is it something where you're going to see what it is now and potentially even worse? At the end of the day, one of the things that people need to remember is the US healthcare system is fractured. We have a little bit of everything. We have a single payer system. If you are 65 and older and receive Medicare, you've put in your dollars for your taxes. So by the time you're 65, you've gotten your Medicare. There's your single payer. You are, you have health insurance. If you have a job that provides you health insurance and it gives you a subsidy of the premium that you're going to pay, there's your privatized health insurance. If you are of a socioeconomic background that meets a Medicaid sort of delineage, and what that means is every state has their own rules and regulations around Medicaid. So if you're in a more conservative like state, you may not have coverage. If you are poor, you can have zero coverage. If you are not documented, zero coverage. So I think it's really important to understand that the United States actually has a fractured system that actually allows for different systems across the world under one roof, but it's not cohesive and it doesn't cover everyone in the United States. And so I think that's really key for us to understand here. The Affordable Care Act was a step, to Delegate Suhas's point, in the right direction at that time, where we were able to start to regulate some of the nefarious practices of insurance companies and pharmaceutical companies writ large. What we have right now is a pro-empathy towards corporations versus pro-empathy towards people. And so if you are questioning about voting, then think about it as the moment and not necessarily be about the man. Joe Biden was not my choice. I just want very clearly, wasn't my choice. And actually, but the thing is that it's very much critical about the moment that we're in and what do we want to see the future for our children to be? What do we want to see for the future of us as a country, just even 2021? I don't think anyone wants to live in a pandemic state forever. And so I just kind of want to put that out there. So that isn't diplomatic, my apologies, but I being very clear about that.
I think you said it right when we started the session, is healthcare is everyone's business. You know, if you have healthy neighbors, you are healthy. And that has actually been shown with the COVID pandemic, is, you know, you live in a community that has access to good healthcare, has like coverage. People don't feel scared to go to a hospital or go to a clinic. You live in a healthy society, and you can see the racial and, you know, social disparities of the COVID pandemic like very starkly. Again, you know, it's unfortunate that we have to like see this in all sorts of different diseases, going back from like HIV and you know, now again with like COVID, you know, it's the same communities that are being you know, affected again and again, and you know, tons and tons of papers have been written about it. And still, again, that's why it's so crucial to sort of think about not just like who you're voting, you know, Biden, Harris, or it's about like your own state, like your own county executive, who's gonna say we will have mask mandate, we will close down, you know, indoor like dining, or, you know, give you some sort of guidance around like local public health impact of how to like survive this chaos. Again, you know, thank you. It's a pretty lively debate, and I do want to ask about like as a physician and this whole PPE fiasco that we are trying to address is, you know, even almost like 8 months into the pandemic, we're still being surveyed whether we are okay by using reusable like N95 mask. We don't have enough masks, and recently we got a letter from our employers as well as other societies that, you know, the combination of seasonal influenza and COVID is going to overwhelm the health system again. So, you know, we haven't even sort of gotten out of the first wave because we had like such a poor like coordinated response. We are facing another huge like sort of like disease morbidity with like combination like COVID as well as like influenza. So just want to get some sort of final thoughts. I know it's almost 8 minutes till 8 o'clock. From three of you around, like, how do we go forward? Like, I know we need to vote, but again, what are the things, maybe like 2 points that you can tell us about how to be active and how to move the needle forward, especially around like COVID, with all this like virtual activism and anything that we can do. If you could give like 2 points beside the voting point, because which sort of seems like obvious at this time, so that we can like close the session. You can, Delegate Suhas, I know you need to leave early, so why don't you take the floor first?
Thank you. And first of all, thank you all again for being here. I guess I've been watching a lot of CNN lately because there's a debate and they always have a Republican and a Democrat. So it's nice to be in one of these where everyone agrees on everything for a change. And I love the points made by the others on the panel. So it's really a pleasure to be here with you guys. I'll just make 2 points and they kind of answer your question, but I think the first thing I'll say is I'm going off a little bit off on a tangent, but it's important to note that we live in a world today where social media kind of dominates a lot of our lives, especially the younger generations who are, don't vote in big numbers. And the mediums that we use create this echo chamber that I think a lot of people are aware of now, finally. And so the ads that'll target certain groups, especially as the election approaches, which is what happened in 2016, will tell them negative things in order to ensure that they don't vote. And they'll tell you that, everything is great and Joe Biden's going to win and, don't worry about it. And they'll tell the Trump supporters, the Democrats are out to eat your babies or whatever they're going to say, whatever lie is going to be come across. And so we've got a very polarized world because of that. And the people who really matter are maybe the people that might talk about politics once in a while, but have never really voted. And in Virginia, at least, the deadline to register to vote is in a couple of days. So I know you said not to mention voting, but I'm mentioning voting again. But I think it's important also that we really think about the people who maybe aren't on this call or aren't listening to this call, but that the call to action is to really talk to the people who are getting nothing but negative things in their social media feeds or in their advertising to them, and to just tell them that, look, we've got a choice to make and our lives depend on it. You need to come out and you need to vote. The second thing is, I had the pleasure of working in the White House as a technology advisor to President Obama. We actually I probably worked closer with Vice President Biden than even President Obama. And I'll say that they were very different. President Obama, when I would write a memo, he would correct my grammar sometimes. He would write things in the footnotes. He read everything that we put on his table that was not Vice President Biden. He wanted the top line, he wanted the talking points, but he was very thoughtful and he was always open to changing his mind and was always open. He was very humble and always said that, if you can prove me wrong, I'm open to it. And he's changed his mind on a lot of issues over the years because of that. But I think that's the kind of leadership we need right now. We need someone who can represent all people, even the Trump supporters, someone who will kind of heal some of the divides in our country right now. I think, perhaps, Vice President Biden might not have been, I didn't vote for him in the primary. I know a lot of people didn't, but I think a really good reason to vote for him is because if you're really sick of the polarization in our world today, if you really want someone who's open-minded, who will listen, who will look at facts, who will take truth on its face and admit fault, this is a really good candidate. You should feel very proud if Vice President Biden becomes our president. And so please come out and vote the right way. Vote for Vice President Biden. Honestly, I think our country really needs him right now.
Thank you.
If I could go next, I think just to follow Delegate Suhas, I can't. Thank you. It was nice meeting you, by the way. So I think the one thing I agree, like if we don't want to talk about voting, but I have to put it out there. people who don't vote, elected officials don't listen to you. And so if you want people to listen to what you have to say as a citizen, you need to vote. Healthier and wealthier folks vote more, and they tend to get more. And so if you are if you're not in that category, then you need to vote. And I do agree with Delegate Suhas. I am about decency, humanity, and unity. And the thing is that our country hasn't been more divided than I've ever had in my lifetime. It has been now, even with other Republican presidents in the past. And I'm definitely not a Republican, but I'm just saying very clearly, like, it's, again, Vice President Biden wasn't my first choice, but I am about democracy, and I am about a chance. And what we have not been able to have under the Trump administration, especially if you are brown and Black in this country, is actually have a chance. And I am looking for decency and democracy to be brought back into our country. And Vice President Biden is that. And so is Senator Kamala Harris. And I really believe that if we're going to have a chance at anything, to have accountability built in anything, build a better healthcare system, build a better community for education, build better communities, safer communities, then you need to have a place and a pathway that allows for that chance. And right now, I don't see that chance with Trump in the White House again. To a point where I'm actually really scared for the livelihood of brown and Black communities in this country. And that includes you. If South Asians don't believe that they're part of that brown community, then they're sorely mistaken. And so I do think that it is really important to understand that. And I do think that Vice President Biden is our chance. It's our chance to bring back decency and humanity. So
can you also
please,
quickly give a plug-in for, sorry to cut you off, but can you also quickly give a plug-in for your voting efforts amongst
yes.
physicians?
So votehealth2020.com is our website. If you are haven't been registered or don't know if you are registered, if you just, you can actually scan the QR code behind me right now, and you can actually check your registration status. If you are registered, if you have an absentee ballot, but otherwise you can go to our website, votehealth2020.com, and everything is there for you. And then go and register the next person. Register the people in your family that are eligible. Please register your neighbors. Go to your grocery stores. We have stickers, we have flyers, we have everything that is free as a resource. It's all there. Just go to the resource tab, and then you can find me through you, I think, Dr. Bijay. That will be great. And if anybody has any questions, happy to help and get people registered to vote.
Thanks a lot. And finally, Dr. Jeyaraj, if you could give like 2 pointers, words of wisdom about like how we can mobilize.
Add on to what Manisha and the delegate said. Manisha, in addition to vote, don't forget the census, because you're not counted, if you don't do the census.
Very
Remember,
true.
the month is the closing of census. So you're nobody, if you're not counted. Remember, strength comes by number. And the other thing that we have done, in this area, southeastern Pennsylvania, we have translated, a lot of material into multiple languages: Chinese, Korean, Hindi, Bengali, Nepali. so, Suman, that. So I think those are also, these are the areas that we could play a role. And my frustration is, the lack of involvement by our community, with elected officials. And I hope more and more, and Manisha is a little optimistic than I am. I just do not see even the younger generation. Whenever I go for any of these fundraisers, I still see the old elderly people coming for all these events. I do not see the younger people. Again, thanks very much, for inviting me.
Sure. As a potential, as someone who thinks I am young, I will say that most of the young people do not go any physical space. They are on TikTok, and if you follow them on TikTok, they are aggressively registering. Celebrities, songwriters, singers, their bios nowadays is all about like voting and how to register to vote, how to find your nearest voting booth. So I am sort of optimist with a little bit of sprinkle of pessimism, given what's going on. But again, thank you for the panelists, and thank you for Mr. Timsona for organizing this. So I get a chance to like talk to you and ask you like questions and learn from you. And thank you everyone who participated on our Facebook. Again, apologies for some of the spam comments that we received. And I wish you all to stay safe in this pandemic.
Thank you for having me. Thank you.
Thank you.
Yeah,
Sure.